Pregnancy isn't just a season of anticipation, it's a profound journey of transformation where your body becomes a miraculous vessel nurturing new life. But amid the glow and excitement, everyday realities like nagging backaches, unexpected leaks, or that overwhelming fatigue can steal your joy if you're not prepared. What if I told you that by mastering a few intentional habits, you could reclaim your comfort, build unbreakable strength, and pave the way for a birth story that's empowering rather than exhausting? Imagine waking up refreshed, moving through your day with ease, and stepping into motherhood feeling resilient and ready. These aren't pipe dreams, they're achievable with the right knowledge. Stick around, because today on the Parent Hub, we're embarking on an in-depth exploration of pregnancy-proofing your daily life. We'll uncover hidden risks in routine movements and arm you with expert strategies to protect your core, pelvic floor, and overall well-being. This could be the game changer you've been craving. Hello, and welcome to the Parent Hub, your ultimate destination for cutting-edge, evidence-based parenting wisdom in 2026. I'm Lily, your host, and a dedicated prenatal wellness advocate with 12 years of experience, guiding families through the highs and lows of parenthood. From my home base in Dhaka, where I've supported countless moms in blending modern science with cultural traditions, I'm passionate about making pregnancy not just survivable, but truly thriving. Whether you're a first-timer navigating the unknowns or a seasoned parent juggling multiples, our channel is here to equip you with tools that honor your unique journey. In this comprehensive episode, we're tackling a topic that's often overlooked, yet profoundly impactful: how to adapt your everyday activities during pregnancy to safeguard your body against common pitfalls. Think about it. Your abdominal muscles and pelvic floor aren't just passive players. They're the unsung heroes forming a supportive corset around your growing baby. As pregnancy progresses, these muscles stretch and adapt, but without proper care, simple actions like bending or sitting can lead to long-term issues, such as diastasis recti, where your abs separate, pelvic organ prolapse, urinary incontinence affecting up to 40% of postpartum women, or chronic back and pelvic pain that lingers well beyond delivery. The stakes are high, but so are the rewards. According to the American College of Obstetricians and Gynecologists ACOG Guidelines 2026, incorporating mindful movement can reduce pregnancy-related pain by 50% and speed up postpartum recovery by weeks. A landmark study from the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, in 2025, further shows that women who prioritize core stability during pregnancy experience fewer complications, better sleep, and even enhanced mental health with lower rates of anxiety and depression. But here's the empowering truth. You don't need fancy equipment or hours at the gym. It's about smart tweaks to what you're already doing: getting out of bed, sitting at your desk, lifting groceries, or chasing a toddler. These changes not only protect you physically, but also boost your confidence, helping you feel in control during a time when so much feels unpredictable. We'll dive deep into each area with step-by-step demos, trimester-specific variations, and real-world examples drawn from the latest research. Before we proceed, a quick disclaimer. While I'm deeply invested in sharing this knowledge, I'm not a healthcare professional. That's why I've collaborated with Dr. Emily Carter, a renowned physical therapist board-certified in women's pelvic health. With 20 years of clinical practice, including leading workshops for ACOG and contributing to Mayo Clinic's prenatal protocols, Dr. Carter has helped thousands of women navigate pregnancy with strength and grace. She's pored over the most current data from sources like the Mayo Clinic Health System, NIDDK, and international bodies such as Canada's Public Health Agency to ensure our advice is fresh, factual, and forward-thinking for 2026. If you have pre-existing conditions like gestational diabetes or a history of back issues, or if you're carrying multiples, please consult your OBGYN or midwife before trying these techniques. Pregnancy is personal, and professional guidance is key. Now, let's hand it over to Dr. Carter to lay the foundation: why these muscles matter, how pregnancy reshapes them, and the science behind the risks. Thank you, Atika. It's an honor to be here on the Parent Hub, especially in 2026 when we're seeing such exciting advancements in prenatal care like AI-assisted posture apps and virtual reality birthing simulations. Let's start at the core. Literally, your abdominal muscles, including the rectus abdominis, those six-pack muscles, and the deeper transversus abdominis, along with the pelvic floor, a group of muscles and tissues spanning from your pubic bone to tailbone, form a dynamic support system. Pre-pregnancy, this system is like a well-tuned trampoline, flexible yet firm, stabilizing your spine, containing your organs, and aiding in everything from breathing to bowel movements. During pregnancy, however, your body releases hormones like relaxin and progesterone, which soften ligaments and joints to prepare for birth. Combined with the growing weight, your uterus expands from pear-sized to watermelon-sized, adding 25 to 35 pounds of baby, placenta, fluids, and more. Your center of gravity shifts forward by 3 to 5 inches, forcing compensatory changes. Your posture might sway into a deeper lower back curve, lordosis, or you might tuck your pelvis to counterbalance, which both overload these muscles. The result is stretched and weakened tissues that are more prone to strain. For instance, the linea alba, the connective tissue between your abs, can thin and separate in diastasis recti, affecting 2/3 of pregnancy, per a 2025 Mayo Clinic review. Pelvic floor weakness contributes to incontinence in 30 to 50% of women, NIDDK data indicates, and can lead to prolapse where organs shift downward. Everyday movements amplify this. A sudden twist while getting up might spike your intra-abdominal pressure, IAP, the force inside your belly, by 200 to 300%, according to biomechanical studies from the Journal of Orthopedic and Sports Physical Therapy. Over time, this accumulative stress can manifest as back pain, impacting 50 to 70% of pregnant women, ACOG reports, sciatica, pubic symphysis pain, or even affect labor efficiency. But here's the silver lining. Research from a 2026 NIDDK longitudinal study shows that women who adopt protective techniques early reduce their risk of severe symptoms by 40 to 60%. It's about working with your body, not against it, using breath, alignment, and mindful mechanics to distribute loads evenly. Let's break it down, starting with one of the most fundamental daily rituals, getting in and out of bed. In the non-pregnant world, we treat bed as a launch pad, sitting on the edge, swinging legs in and flopping back, or crunching up like a sit-up to exit. It's quick, but by the second trimester, that crunch motion compresses your abs against the growing uterus, spiking IAP and straining the pelvic floor, which is already bearing extra weight. A 2024 ACOG update notes this can exacerbate round ligament pain or contribute to insomnia from discomfort. Instead, embrace the log roll technique, a staple in physical therapy for spinal protection. Here's how. Approach the bed and sit on the edge with your bottom well back so the mattress supports behind your knees, feet flat on the floor for stability. Inhale deeply to prepare. Then, as you exhale, lower yourself onto your side by leaning onto one elbow while simultaneously lifting both legs together onto the bed. Roll gently onto your back, keeping knees bent to reduce lower back strain. If you're in the third trimester and feeling extra heavy, place a pillow under your knees for added support. This aligns your spine and eases hip pressure. To get out, reverse the process. Start on your back, then roll fully to your side. Left side is often recommended after 20 weeks for optimal blood flow, per Mayo Clinic. Bend your knees, and as you exhale, push up through both hands, one on the bed in front, one behind for leverage, while swinging your legs off the edge. Keep your shoulders stacked over your hips to avoid twisting, which could irritate the sacroiliac joints. Practice this in the first trimester when it's easier, so by later stages, it's second nature. Variations. If you have hip pain, widen your stance when sitting up. For back issues, add a slow neck stretch once upright. Real-world tip. In 2026, many smart beds with adjustable firmness can help, but technique trumps tech. If pain persists, see a PT for tailored assessments. Early intervention prevents escalation. Shifting gears to sitting, an activity that dominates our days, especially with remote work booming in 2026. Pregnant women often adopt suboptimal postures, perching forward on the chair's edge to accommodate the belly, which exacerbates the lumbar curve and pressures the pubic symphysis, leading to sharp pains in 20 to 30% of cases, ACOG stats show. Alternatively, slumping back causes a posterior pelvic tilt, rounding the lower back and compressing discs, which can hinder fetal positioning and increase low backache. Mayo Clinic's 2026 ergonomic guidelines emphasize that poor sitting contributes to edema, or swelling, and varicose veins by impeding circulation. The fix? Optimal alignment starts with chair selection. Choose one where your hips sit slightly higher than your knees. Use a footrest or stack books if needed, aiming for a 100 to 110 degree angle at the hips to open the pelvis. Sit all the way back, ensuring your lower back contacts the chair. If there's a gap, roll a small towel or use a dedicated lumbar cushion to maintain the natural S-curve of your spine. This supports the lordosis without overdoing it. To find neutral pelvis, place one hand under your buttocks and gently separate the cheeks to sit directly on your ischial tuberosities, sit bones. This prevents rocking. Open your collarbones by rolling shoulders back and down, elongate through the crown of your head, and relax your jaw. For desk setups, position your screen at eye level to avoid forward head posture, which adds 10 to 20 pounds of effective weight per inch forward, per chiropractic research. Take micro breaks every 20 to 30 minutes, stand, shake out your limbs, or do a seated cat-cow stretch. Inhale to arch your back slightly, exhale to round gently, promoting spinal mobility. In cars or on public transport, use seat belts below the belly and add cushions for support. If working long hours, incorporate standing desks intermittently to alternate loads. Posture extends to standing, where pregnancy's forward shift can lead to compensatory extremes, an anterior tilt, belly leading, arching the back, or posterior tilt, tailbone tucked, flattening the curve. Both hike IAP by 15 to 25%, straining the pelvic floor and contributing to fatigue, as a 2025 NIDDK biomechanics study reveals. Neutral standing is your anchor. Position feet hip-width apart, weight balanced over arches, not heels or toes, to engage leg muscles. Soften your knees to unlock them, preventing hyperextension that stresses joints. Gently rock your pelvis forward and back several times, noting the extremes, then settle in the balanced middle where your pubic bone and tailbone feel level. Stack your anatomy. Ribs directly over hips, avoid thrusting chest forward, shoulders relaxed away from ears, and head aligned so ears are over shoulders. Imagine a string pulling you tall from the crown. For prolonged standing, like cooking or queuing, shift weight side to side every few minutes, or prop one foot on a low stool, 6 to 8 inches, to alternate pelvic tilt and reduce fatigue. Wear supportive footwear with cushioning and a 1 to 2 inch heel max. Avoid flats that lack arch support, as Mayo Clinic warns they can worsen plantar fasciitis, common in pregnancy due to weight gain. Compression stockings, updated in 2026 designs for comfort, combat swelling by improving venous return. Integrate breathwork. Inhale to expand your belly and ribs 360 degrees. Exhale to gently engage your core without bearing down. This diaphragmatic breathing oxygenates baby and stabilizes your posture. If standing jobs are your norm, discuss accommodations like anti-fatigue mats with your employer. Now let's tackle lifting, a necessity from picking up toys to hauling shopping bags. The golden rule: coordinate with your breath. Exhale during the exertion phase to recruit the transversus abdominis and pelvic floor, creating a natural brace that manages IAP. For general objects, adopt a split stance, 1 foot forward for base stability. Inhale as you hinge at the hips and bend knees to lower, keeping your back neutral, not rounded. Grasp the item close to your body to minimize lever arm stress, then exhale firmly as you drive through your heels to stand, using glutes and legs over back muscles. Avoid breath holding, which can spike blood pressure, a concern in pregnancy per ACOG's hypertension guidelines. For heavier loads like groceries, limit to 20 to 25 pounds repetitive lifts post 20 weeks, ACOG advises. Squat deeper if needed, hug bags to your midline, and rise slowly on the exhale. To lower, reverse. Inhale down, place item, exhale up. In tight spaces like unloading a car, pivot your whole body with feet instead of twisting at the waist to protect obliques. Examples: lifting laundry, stack baskets at waist height first. Grocery runs, use carts or bags with handles, distribute weight evenly. If pain signals, stop and reassess, perhaps delegate or use tools like reachers. With toddlers in the mix, lifting gets dynamic. The instinctive hip hinge and yank, bending forward, arms extended, channels force through the weakest abdominal point, the umbilicus, heightening diastasis risk. Instead, face your child squarely, widen stance to shoulder width or more for balance. Inhale as you squat, knees tracking over toes, scoop them close to your chest like a hug, then exhale to stand tall, engaging core lightly. If they're wiggly, kneel on one knee for lower access. To set down, maintain hold, squat inhaling, place gently, exhale, rise. Trimester tweaks: first trimester, focus on form. Second, add breath emphasis. Third, use furniture for support if belly obstructs. Carrying toddlers or bags, ditch the hip carry, which asymmetrically loads one side, pulling abs apart and twisting the spine. Mayo Clinic 2026 data links this to increased separation severity. Hold centered in front, arms cradling under bottom, or use carriers ergonomically fitted, chest high, straps wide. If tilting backward occurs, rock pelvis to neutral and soften knees to redistribute weight. For long carries, take breaks or switch sides mindfully. Baby-wearing slings, evolved in 2026 with breathable, adjustable fabrics, distribute load evenly if hips are supported. Consult a carrier specialist. Pushing tasks, like strollers or carts, can subtly strain if misaligned. Handles too low force leaning, spiking abdominal tension. Too high causes shrugging. Adjust to elbow bend at 90 degrees, wrists neutral. Step forward into the push, leading with legs and core, not arms, to propel efficiently. Keep the object close. If it pulls ahead, it yanks your posture forward, per Canada's 2025 Ergonomic Guide. On inclines, shorten strides. Exhale per push. For rough paths, engage abs gently. Modern strollers with suspension help, but form is foundational. Sleep positions warrant attention too. After 16 to 20 weeks, avoid supine, flat back, to prevent inferior vena cava compression, which reduces blood flow to baby and you, causing dizziness or low oxygen, NIDDK warns. Opt for side lying, preferably left for optimal circulation. Bend knees slightly, place a pillow between them to align hips and reduce sciatic pressure. Another under your belly supports the weight. Full-body pregnancy pillows, popular in 2026, cradle your form. Experiment for comfort. If heartburn hits, elevate your upper body with wedges. Pelvic floor health is non-negotiable. Weakness affects continence, sexual function, and birth. Kegels are classic. Identify muscles by stopping mid-urine flow, don't do during voiding routinely, then squeeze and lift as if holding gas, hold 5 to 10 seconds, relax fully. Repeat 10 to 15 times, 3 to 5 sets daily. Vary. Quick flicks for urgency control, sustained holds for endurance. Add bridges. Lie supine, early pregnancy, or side-lying later, feet flat. Exhale to lift hips, squeezing pelvic floor. Hold 5 seconds. Lower inhaling. Progress to standing versions. Biofeedback apps in 2026 provide real-time cues. Stretches complement. For back relief, cat-cow on all fours. Inhale, arch back, look up. Exhale, round, tuck chin. 10 reps to mobilize spine. Pelvic tilts against a wall. Stand, flatten lower back by tilting pelvis, hold 5 seconds, alternate with gentle forward tilts. Hip openers like butterfly sit, soles together, knees out, ease groin tension. Always gentle, no bouncing. Broadening to exercise, ACOG and NIDDK recommend 150 minutes weekly of moderate activity, brisk walking, swimming, buoyancy eases joints, or prenatal yoga to curb weight gain, gestational diabetes, reduced 25 to 30%, and C-sections. Mental perks, endorphins combat mood swings. A 2026 Mayo study ties exercise to lower postpartum depression rates. Start slow, 10-minute walks, build intensity. Strength routines, wall angels, back to wall, slide arms up and down for posture. Seated marches for core. Third trimester, focus on relaxation poses like child's pose, kneeling forward over pillows to stretch back and open pelvis. Nutrition intersects. Fuel with iron-rich foods like spinach and lean meats to fight anemia exacerbating fatigue. Omega-3s like salmon and walnuts for joint health. Fiber like fruits and grains against constipation straining pelvic floor. Hydrate. Aim for 10 to 12 cups daily to maintain tissue elasticity. Mental health ties in. Mindful movements reduce stress. Pair with meditation apps tailored for pregnancy in 2026. Involve partners. Teach them these techniques for support. Joint walks strengthen bonds. Debunk myths. Don't lift anything. No, safe lifting builds strength. Back pain is inevitable, not with proactive care. In summary, these adaptations, from log rolls to neutral lifts, fortify your body, minimizing risks and maximizing joy. Tailor to your needs. Seek pros for customization. Back to you, Atika. Thanks, Dr. Carter. Pure gold. If this empowered you, hit like, subscribe to the Parent Hub, and bell for notifications. Our prenatal series debuts with advanced core and pelvic routines for every trimester. Link below. Covers safe workouts to prevent pain, aid labor, and hasten recovery. You're incredible. Embrace this chapter. Until next time.